Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us. Now we've all been focused on avoiding COVID-19, but people should not neglect their other healthcare needs because underlying conditions are linked to more severe illnesses from COVID-19. Now, NASH is one of the most common diseases that increase your risk with COVID. Now, here to talk about International NASH Day that's coming up next week is Wayne Eskridge, founder of the Fatty Liver Foundation and cirrhosis patient, along with Donna. She's president and CEO of the Global Liver Institute. Welcome both Donna and Wayne. Thanks for joining us this morning.
Good morning.
Thank you.
Well, Donna, what is International NASH Day and what is NASH?
Sure. So NASH is non-alcoholic steatohepatitis. So most people don't realize that there are a host of things besides alcohol that can cause liver disease, liver damage. And this is one of those conditions. It's more driven by obesity, diabetes, cardiovascular disease. And so that's why it correlates with an increased risk of severe reaction to COVID because it's in line with those. And so that's one of the reasons why International NASH Day, which is June 12th this year, is even more important during this time of the pandemic. International NASH Day, which is an initiative of the Global Liver Institute, endorsed by the major hepatology medical societies of the liver docs, in both the U.S. and Europe, with 50 partner organizations and 30 different speakers across the day from many countries. Why it's even more important to have International NASH Day this year, because so much care, as you said, so much care has been postponed to COVID, so much screening and testing and research has been stalled, so much drug development and regulatory activity has been put on hold, and that's very dangerous, particularly for NASH patients, because this is a chronic progressive disease, and so it didn't stop just because there's COVID. In fact, we're more vulnerable to COVID, so it's even more important that all of those activities continue. So on International NASH Day on June 12th, we will be shining a spotlight to share education with people, many of whom haven't heard about NASH before, but may or may not be living with it already, unknown. And we'll be having speakers almost every hour throughout the day so that people can understand different aspects of this, of how it affects children, so pediatric NASH, how it affects people with diabetes or cardiovascular disease, and how this is a global public health challenge, and topics like that from a variety of viewpoints, how you can safely use non-invasive technologies and get beyond liver biopsy and still continue your care safely during this time. So, we're really excited about everybody that we're bringing together, and really hope that, by June 13th, everyone will know about NASH. Everybody will have some action that they can do to either just at home with their lifestyle or with their doctors on a telehealth visit, to start to understand what their personal risks are or how they can be helped in somebody else in their community who's struggling with a disease.
Now, Wayne, you were diagnosed with NASH, of course, long before this COVID-19 pandemic. Were you diagnosed properly initially, or were there some things that took place making people think that you were alcoholic, or that alcohol played a role in your cirrhosis, and did that cause them to treat you differently?
That is a problem that we really do have. People hear cirrhosis and they assume alcohol, but actually far more people have cirrhosis as a result of NASH and NAFLD. We just don't hear about NASH in our society. In my case, I'm typical in that I went through years of being misdiagnosed and diagnosed for other things and examined for other things and tested for a lot of different kinds of conditions, and never received a liver exam because the physicians generally aren't really screening for this disease. One of the purposes of the Fatty Liver Foundation is to make it more clear that those screenings need to take place and that people need to be concerned about their liver. One of the statistics that might surprise you is that if you have two friends, one of you has a fatty liver. It is about the most common problem that we have in our society, and it's growing with the way that our obesity problems are advancing. And as we become more sedentary and we become bigger, we will have more NASH disease, and it becomes really a serious problem for medicine, because it's a tidal wave of disease that's going to break the back of the medical profession if we don't get a handle on it. And that's one of the reasons for the NASH Day, is to try to get people to understand that it even exists, because most people haven't heard of it.
Are there any concerns when it comes to triage and COVID-19 and NASH during this pandemic? If someone is actually suffering from NASH as opposed to alcoholic cirrhosis with other underlying conditions, are there any major concerns there?
It's a very serious concern, because people who have liver disease, whether it be alcoholic or non-alcoholic, are at much greater risk of death from COVID. And the problem with COVID and not taking care of these other diseases is one of our great concerns, because if we don't manage the other diseases, COVID becomes far more dangerous.
Donna, what's your hope for the future, helping folks with fatty liver and other liver diseases?
My hope for the future is that when someone presents in a doctor's office with risk factors for NASH, that their doctor immediately recognizes that that's a possibility and screens them appropriately, either through blood work or non-invasive testing, so that they're taken seriously and put in a care pathway. My other hope is that there is a drug, a medication developed with a specific indication for NASH in the U.S., and that will catalyze an increased level of attention and activity, as well as giving a real pharmaceutical option, in addition to the lifestyle interventions and some surgical interventions and other things that people are sort of cobbling together right now to try to manage patients. I really hope that we can make the advances on both ends, on identification of patients and of treating them more effectively.
Wayne, give us a website where our listeners can go and learn more about NASH, about the Fatty Liver Foundation, and the Global Liver Institute as well. Sure.
Ours is at fattyliverfoundation.org, and Donna is at globalliver.org. Both of us have a lot of information about the disease and what to do.
Great. Well, I thank you both, Wayne Eskridge and Donna Cryer, for joining us here on Health Professional Radio this morning. Lots of great information.
Thank you.
Thank you.